I've been interested in, well, I've been aware of since I realized since high school, essentially, because I had an interest in microbiology that goes back a long way. And through the years of my education, there's always been a focus on microbiology as an undergraduate medical student. And obviously, when I went into infectious diseases. So it's, it's, it's great for me to talk about Hinton. It's also something every time I revisit Hinton or interact with other people about Hinton, I I learned something new, and there's a sparsity of information about Hinton because he didn't really write about himself. He didn't leave any significant personal ideas, thoughts, and nobody's done a definitive biography. So basically, it's all bits and pieces that people have put together, a wide variety of people. And so I should start with some disclosures. I'm not an historian, either, even though I use that particular um, article. Uh, my only formal training is in infectious disease, internal medicine. And as I said, I've had early exposure to Hinton. And when I started working at the Massachusetts State Public Health Laboratory, that, that interaction became more because although he worked there for a limited time, as you'll see later on, much of whatever was left of his laboratory records were at the state lab in Jamaica Plain. And I want to acknowledge Marion Johnson Thompson, who participated in a program on Hinton uh, several years ago at the Public Health Museum. Aniel Rodriguez, who is a graduate student with Scott Podolsky at the Center for History of Medicine, and Eric Munson, who's a microbiologist who wrote a paper on Hinton. And they've all provided more information for me and inspiration to dig more in certain areas. So, who was William Augustus Hinton? He was an internationally recognized authority on syphilis and a clinical pathologist. He was the chief of what was called the Wasserman Lab at the Department of Public Health from 1915 to 1953. Uh, he also did a lot of routine microbiology for the Department of Public Health in that Wasserman laboratory. He's most famous for developing the Hinton test, which you'll hear more about. It was a significant advance in non-treponemal syphilis serologic testing. He was a consultant to the U.S. Public Health Service on syphilis as well as other treponematoses. He was pathologist in chief at the Department of Clinical Laboratories at the Boston Dispensary, uh, which was founded early in the 19th century. For the same period of time, he was director of the Wasserman Laboratory. He published the first medical textbook by an African American, and he was the first African American professor at Harvard Medical School, for that matter, at Harvard University. So he had all of these accomplishments. He was born in Chicago in 1883. Both of his parents were born enslaved. In early life, they moved to Kansas City, Kansas, where he graduated high school in 1900 at 16 years old. He is said to have been the youngest graduate of that high school. Um, he went to the University of Kansas. He packed 3 years of classes into 2 years and then transferred to Harvard College, where he got his Bachelor of Science degree in 1905. And then he didn't know what he was going to do. So he considered going to law. He got a job in law office. And one of the few quotes related to his private life, he is quoted as saying, legal appetite cannot always be cultivated. So he became a science instructor at Walden University in Nashville, Tennessee, one historically Black colleges and universities, and then to the what was then the Oklahoma Colored Agricultural and Normal University became Langston University, another historically black university. While he was there, he met Ada Haas, who became his wife. He decided that he was going to go to medical school. And it's interesting because throughout his life, he decides to do something and then he does it, despite um, obvious and not so obvious challenges that he faced. He went to the University of Chicago um, in 1909 to do pre-med courses during the summer, and then applied to Harvard Medical School and was admitted that same year. He uh, also married Ada Hawes the same month that he started medical school. He was fortunate to get a merit scholarship, the Wigglesworth Scholarship, which was competitive, as well as a scholarship for African American students, which was started by was initiated by Lewis Hayden. So, and many times it said he accepted the Wigglesworth but declined the Hayden, which never made sense to me because it wasn't true. Because he needed the money, he just got married, so he accepted the merit scholarship and the non-competitive scholarship. While he was in medical school, he worked in the laboratories of Richard Cabot, who was the founder of the clinical pathological conferences at the Massachusetts General Hospital that got published in the New England Journal of Medicine, the case records, as well as the neuropathologist Edward Southard. So he had a big interest in laboratory medicine, hematology, and neuropathology, especially neuropathology of syphilis, which was a very big deal at the time. After 3 years, he graduated cum laude. Here is how this is when Harvard Medical School, the new campus, looked in 1909 when he was admitted. And then in 1912, no Boston hospital will grant him an internship. Now, now we're sort of used to programs, training programs, admitting their trainees. But in those days, it was the hospital administration, and they did not admit uh, African American trainees. So he wound up volunteering in the Department of Neuropathology, where he had been working earlier at the Mass General Hospital. And he learned the Wasserman test, which had just been invented in 1906. The Wasserman lab was started at Harvard in 1909. He became interested in syphilis before this, but he honed his skills both in terms of autopsies on syphilis cases and clinical observation, and participated in rounds on these cases. And he trained with J. Homer Wright in anatomical pathology. The Wasserman Laboratory was established in 1909. It was established by the Southard. In 1915, it was transferred to the Department of Public Health. The state legislature the year before had legislated free syphilis testing for anybody who needed it or wanted it. So they needed a way of doing that. So the state took over the funding of the Wasserman Laboratory and took over the management of the Wasserman Laboratory, initially making Hinton the assistant director, but that was a very temporary thing. He became the director and the chief of the Wasserman Laboratory. And as part of that was made deputy director of the biologic laboratories, which was essentially what the rest of the public health laboratories were in Massachusetts, in addition to the Lawrence experimental station on the banks of the Merrimack River. So he was situated at Harvard Medical School in Building D, room 103, and the rest of the biological laboratories were at in Jamaica Plain, and then the Lawrence Laboratory up in Lawrence. So this is where, and this is where his laboratory was from 1915 until after World War II. So at the Department of Public Health, he was responsible for syphilis testing, obviously, but also he did testing for the Division of Livestock Disease, as well as a variety of other testing for the Department of Public Health. He also ran a certification program for other laboratories doing Wassermann testing, which was very innovative at the time. Many states developed certification, clinical laboratory certification, but he was one of the leaders there, and developed testing for other sexually transmitted infections as well. And I was able to determine that his starting salary was $1,200 and went to $2,000 by 1918. Now, looking at what physicians in Boston were making, it was anywhere from $1,800 to $7,000 a year. So he was at the low level of the range. But at the same time, he was the director of clinical pathology at the Boston dispensary. So that was the other part of his salary. And it must have been incredibly busy. The more I think about this, and you'll see some of the data later on, that he must have been working all the time. So this was the memo that was sent out to announce the Public Health Wasserman Laboratory. And basically, clinicians would have to use a kit, a set of tubes and blood drawing devices that would then give them a specimen that would be sent to the laboratory. And they could not send the specimen in with the patient's name on it because syphilis wasn't reportable in Massachusetts. So, as being involved in HIV surveillance at a time when AIDS was not reportable, AIDS was reportable, but HIV was not reportable by name, there was a similar circumstance from 1915 to 1918 in Massachusetts that you could not identify someone with syphilis, even to the Department of Public Health. One other thing he was involved in, and there were several other as well, but he also ran the test of the O'Leary influenza vaccine, which was developed in 1918 because of the identification of Pfeifferella influenzae, Haemophilus influenzae, in cases of influenza, and the idea that it might be the etiologic agent of influenza. So O'Leary developed this vaccine, and the administration of the vaccine to inmates of a variety of state institutions was overseen by Hinton. Now, this we could discuss this later, but the fact is this was not consensual testing. This was people in the custody of the state for whatever reason who were then enrolled in the study. But Hinton was able to demonstrate, especially with the Munson State Hospital, which was actually the state primary school as well, that the vaccine didn't work. No surprise there because influenza is caused by a virus and not Haemophilus influenzae. He also did Wassermann testing on a variety of different patient groups at a variety of different state institutions with an overall positivity of 15% among institutionalized individuals in state facilities, with the highest rate in prisoners and the lowest rate in cancer patients and pregnant women in these state facilities. So this established a baseline that hadn't been fully appreciated prior to that. And I just want to remind people, as Osler said, no syphilis in all its manifestations and relations and other things clinical will be added unto you. And that was because syphilis was so prevalent and the consequences of syphilis were so protean and prevalent. So, and Hinton was there on the front lines. And I think, he kept a low profile, but if you go through the historical Boston Medical and Surgical Journal, the New England Journal of Medicine as it became, you can see he's cited very often as an authority, as the contact person, as a discussant on cases. So within the Boston medical community, he was highly regarded and respected, but less known in the rest of the country. And you can see during his time running the Wasserman Laboratory for the state, syphilis was highly prevalent. And by the 1980s, it had come down to around 2025, where actually it is today, because it went down further and has come back again, as many of you have heard. Now, during this time, from around 1920 to 1927, Hinton worked on developing a type of test related to the Wasserman test, a precipitant test that would be easier to do than the Wasserman. Now, he wasn't the only one. Kahn, Klein, a variety of other laboratorians were developing such tests and had developed such tests. But from looking at the records and looking at the publication, he was sort of intensely focused and methodically intense in terms of developing this. And by 1927, he had developed a test and was sort of beta testing it. He didn't use that term, I'm sure. He was beta testing it in a variety of different clinical laboratories. And by 1934, he was comfortable enough to make it the primary test in his Wasserman laboratory, and it was adopted as the best available test, or recommended as the best available test by the US Public Health Service. Ultimately replaced the Wasserman in many situations. And Hinton continued to oversee serologic testing, including now his Hinton test, which became the test. Now, in 1927, he published this paper, and within weeks, if you go through the case reports in the New England Journal of Medicine, you see them referring to the Hinton test. So it was adopted, at least at the Mass General and other hospitals in Boston, even though he was still not fully comfortable. He thought it needed more trial before it could become the routine test, even in his own laboratory. So he was doing it often in parallel with the traditional Wasserman and with the Kahn test, that earlier non-Wasserman test that was developed in the 20s. And this is an excerpt from the 1927. He said, in addition to tests indicated in this table, because he's doing his annual report, he says this test was discovered in the laboratory. He's publishing that article on June 16th, and that he thinks it's a better test, that it's superior to the Wasserman, but he thinks it's not ready yet. It needs more testing. So he was, and people who knew him as a perfectionist. He was very rigorous. The response to the Hinton test was generally positive. Of course, there were at least two southern states who stopped using the Hinton test when they found out that Hinton was African American. But otherwise, in more sensible places, the Hinton test became sort of the most popular test because it was easier and more reliable with less false positives, which were recognized as a big problem because if you're requiring syphilis testing for pregnant women, for ultimately for marriage licenses, you didn't want the trauma of false positive testing. Well, the true positives were traumatic too, but false positives were unnecessarily traumatic. But look at this. This is the volume of syphilis testing. You know, down in that first floor laboratory at Harvard Medical School, Hinton and his relatively small group of technologists were doing hundreds of thousands of tests. And each of these tests requires several tubes, decanting serum, reading the tubes. These are all glass tubes, by the way, of course, and need to be cleaned and reused. And then by 1942, they did over 700,000 tests. I couldn't believe this. I kept going back to the original records, which we hold at the Public Health Museum. So how could that possibly be? But there they were, 700,000 tests. And this is how the test was done. You got tubes, you got mouth pipetting. This is actually Emmy Thomas, who's one of our wonderful volunteers and a great microbiologist doing the Hinton test as part of her training. And this is the manual, the syphilis manual, manual of syphilis testing from the American Public Health Association, which lists the history of tests for syphilis. Now, this is a non-treponemial test. That means it's not specific for syphilis. It's correlated with infection. So you have to do a treponemial test to confirm that it's actually positive because of syphilis. But look at this. Where's the Hinton test? It's not there. The test at the CDC or the Public Health Service, there's no CDC at the time, the Public Health Service said was the best test is not listed here. So leave people to come out. I don't know why it's there. I have a suspicion why it's there, but I don't know why it's there. But I think it might have something to do with Dr. Hinton's race. Syphilis was huge in the 1930s. Thomas Parent, it was like his number one thing, the conquest of syphilis and the eradication of syphilis. Now, there was no penicillin, so that would have to be done through a variety of preventive measures. And they actually had anti-syphilis rallies and meetings, posters, traveling clinics, testing campaigns, door-to-door campaigns. It was a huge part of the public health service. And was a great focus. And obviously Hinton, as a consultant to the Public Health Service and as the developer of a test that was recommended, was a big part of this. But he didn't attend national meetings. He was a member of the Society of American Bacteriologists, which became the ASM, the American Society for Microbiology, at least since 1921, but he never went to a national meeting. And I think part of this was he often couldn't stay in the headquarters hotel. And even if he could stay in the hotel, in many parts of the country, if you were Black, you couldn't use the elevator. So the difficulties and the humiliations that explicit racism at the time conveyed was significant. And he did not think race should be any part of his work, and we'll get back to that. So, and in fact, Marion Johnson Thompson told me she once asked his daughter, and his daughter just said he didn't want people to know he was black because he thought it would bias them in interpreting and evaluating his science. This is a paper that he wrote. No, I'm blank. I think 1938. I can't see the date, so anyway, it's about the significance of positive blood tests. And so he talks about people, his focus was on primary, secondary, and early syphilis. So he says that if he had a positive test and knows that he couldn't have had syphilis except for decades before, because of the nature of the treatment with arsenicals and mercury, he would choose not to be treated. He, you'll see why I said that. He published, as I said, the first textbook by an African American. Now Rebecca Crumpler, people will say, well, she published a book in the 19th century, an African American woman physician, and she did, but it's considered a guidebook for the public and not a textbook, although it still was a remarkable achievement. So he published this book because he wanted a clear, simple, relatively complete account. Now it's a huge, well, it's a big textbook, single author. The depth and breadth of his knowledge of syphilis is more than adequately conveyed in that book. And one of the things that we have in the collection from the Public Health Laboratory is Dr. Hinton's copy. Now, this gives you an example. This is a treatment of syphilis. There are pages and pages of treatment because it was months of injections, and it was excruciating. It made the old interferon ribavirin hepatitis C treatment look mild in comparison. But he was sort of, it's presented in a way that is easy to follow. Doesn't look like that right here, but the fact is it's almost like a cookbook that people could follow to treat syphilis. Now, the Tuskegee syphilis trial started 1932 and unfortunately went all the way to 1972. Hinton was a consultant for the US Public Health Service on syphilis. He had to know about the trial. He doesn't talk about the trial, but I think it gives you some idea of how he thought about maybe the trial in terms of what it was designed to do, to see if there was any benefit to giving that intensive treatment to people with late syphilis. That was the provided reason for the trial, to see what would happen in the long term to people with late syphilis who were not treated, to see if treatment would have made a difference, presumably. Now, too much to get into, ethically big issues here, but he did not comment on it at any time that I've become aware of. And this is another thing, if there's anybody on this Zoom who happens to have come across something he said about it, please let me know. Now, in 1938, because of his success with the Hinton test and the fact that he was, through ACP, awarded the Spingarn Medal, which is its highest award, to Hinton, because of the recognition of his contributions, especially the Hinton test, which was recognized as the, the best test. The most famous African Americans in history get this award, and it's given to this day. The only year it wasn't awarded was 1938 because Hinton refused to accept it. He's the only person ever to do that. He, he said that he did it because he wanted his work to stand on its own merit and not his race. He later, in an interview with Ebony magazine, essentially the only sort of public interview that he did, he said race should never get mixed up with the struggle for human welfare. So again, all I can quote is Marion Johnson Thompson and the what his daughter said. His academic career, I already mentioned he was the first African American professor at Harvard, of course, 1949, which I think is also the first year that women graduated from Harvard Medical School. All right, better late than never. He was made a clinical professor in bacteriology and immunology. Now, he'd been on the faculty as an instructor and lecturer for a number of years before that. And he retired, he reached 65, so he retired the next year and was made an emeritus clinical professor. He also taught at Simmons, Tufts, and the Harvard School of Public Health. And in 20, I'm sorry, I think it's 2022, the Oliver Wendell Holmes, 2022. The Oliver Wendell Holmes Society at Harvard, a student society, was renamed the William Augustus Hinton Society, primarily because the students, even though Oliver Wendell Holmes was famous and aseptic delivery, etc., in medicine, he turned out the African American students from Harvard Medical School when he was dean. Anyway, so the society is named after Hinton. As I mentioned, he also became the pathologist in chief of the Boston Dispensary. Boston Dispensary has a very long history. It was one of the first clinical units that used to send people to the homes of patients. In fact, Oliver Wendell Holmes was one of the clinicians there in the early 19th century. And Hinton was the director of laboratories. And in 1929, he started one of the first schools to train medical technologists. Prior to that, technologists got trained on the job in the laboratory. He started a formal program primarily for women. And that was another unique aspect of this, to train women right out of high school to be medical technologists. It continued at the dispensary at Tufts for many years. In 1964, it moved to Northeastern and continued for another 20 or 25 years thereafter. Now, we have a lot of medical technology programs now, probably not enough of them considering the shortage, but this was a very unique program. Dr. Eric Reines, who was on this call, had a patient who trained in that program out of high school in 1950 and waxed eloquent about William Augustus Hinton, about how kind and how um, conscientious he was about training and how he everything had to be done until it was done right, but he was always very gracious and kind, and changed her life. I'm so glad I got this on video because it's really moving. Her reminiscences about Hinton, somebody who actually knew him and knew what he was like and trained with him. Now, she also, it's interesting because I hadn't thought about this too much, and I should have. In 1941, he was driving, in February, and between Canton, where he lived, and one of his work sites, he was in an accident where he wound up losing his left leg. Left leg. We'll get back to that. Anyway, uh, he he was brought. Yeah, he could drive himself. He was a master. In fact, people said it was very exciting to drive with him because of his hand things and so forth. But he could drive. But it was clear that she remembers him having sort of a personal care attendant, somebody who helped him get around and get to work at the dispensary. Um, eh, Looking at who did he associate with? One was Ruth Easterling, who was an African American physician, graduated from Tufts in 1921, and he sort of took her under his wing. Uh, Again, the options were not very great, so pathology was a way to go. And she collaborated with Hinton and also with John West on serologic testing and tuberculosis, and had a all too short career. But there's now a scholarship of Tufts named after her. He also, um, in 1920, and I'm sorry, I'm just blanking once again. I'll get back to it. I also found out in a program with the Framingham Historical Center on Solomon Carter Fuller, the said to be the first Black psychiatrist, neuropathologist, neurologist, that he and his family and Fuller's family would often celebrate holidays together. And when Solomon Carter Fuller vision became so impaired he couldn't read, that Hinton was among those who read to him. So gradually, little pieces of his private life come out. His wife is another very interesting person. As I said, he met her at Langston University, and she was 6 years older than him, had gone to Atlanta University, and then to graduate school in Chicago. And they had two children. In 1916, they bought a house with a considerable amount of land in Canton on Dedham Street, 13 Dedham Street. And he actually did a lot of gardening and farming throughout his career, even into the 50s, even after he lost his leg. And his grandson told me that during the summer, he and his sister, who lived in the Bronx, would be put on a train and then the porter would make sure they got off the train at the Canton station, and his grandfather would pick him up, and they would spend the summer on this farm. Especially when these kids from the Bronx, it was really a farm in Canton. He had two daughters, one born in 1916, when just after they moved into the house, and then his daughter Jane in 1919. And when when Anne was 10 and Jane was 6, they were sent to France for school. Otherwise, they had gone to Canton public schools, but it was decided to send them for a period of time, and I'm not sure how many years it was, but they did become fluent in French, to France for their education. And this is their house in Canton. And this is a picture from that Ebony magazine article that I mentioned earlier in Canton. Now, obviously, you could get around with 2 canes as well. And anyway, this sort of gives you an idea of one of the ways he got around. This is that article from the from Ebony magazine. I don't know how some of it is cut off. Anyway, this is really the only time he like quoted about personal things. And one person I want to point out is Genevieve Stewart here. Genevieve Stewart was his chief technologist, ran his laboratory, and was his interim successor when he retired from the Department of Public Health in 1953. Now, I tell you all that because looking at the employment records from 1915 to 1918, there's this interesting, the new employees had to fill out a form and say what their job was. This is like way before that Musk email. And she was 19. She was just out of high school, and she was hired as a stenographer. So he trained her to ultimately become a very successful senior laboratory technologist. And here she is at the state lab after he retired with all those tubes again, with somebody doing the Hinton test in the Wasserman laboratory. I started talking about Ada Hinton, and I really want to tell you more about her. She graduated from Atlanta University, then got a master's degree at Chicago. In 1914, before they moved to Canton, they lived on Fenwood Road near the Brigham for a while, and then they moved to Cambridge for a while on Cambridge Street, and then they moved to Canton. And but in 1914, they lived in Cambridge, and she showed Martha May Elliott, the great maternal and child health, child bureau leader, author of the maternal and child health parts of the Social Security Act. She and Hinton were the first African American professionals Martha Elliott ever came to know, and Ada Hinton showed her around Boston. And from 1925 to the 1950s, she served on the Home for Aged Colored Women. The Home for Aged Colored Women started in 1860. It was basically a place that aged colored women who could no longer work could go because they had nowhere else to go if they didn't have any support, any social support or family members. So this home was started as a charity. Ada Hinton joined the board in 1925. ultimately, it became the Grimes-King Foundation and exists today. And I'm very proud to say that I am now on the board of the Grimes-King Foundation. But if you go through the records of the Grimes-King Foundation, it was Ada Hinton as a leader on the board who transitioned that organization from providing basically a rooming house to providing accommodation in the community, to supporting people staying in their existing accommodation or arranging for other accommodation in the community. So she was a major figure in that organization, also involved in a variety of activities in Canton. So they were very much a part of their community. His daughter, Jane, um, wound up going, and both daughters actually wound up going to Montpelier Seminary in Vermont. There's a little, private schools. He could afford to send them to private schools and obviously thought they would be better off. She went to Simmons. Then, after she got a job in the laboratory of John Mueller. So she is the Hinton of Mueller Hinton Agar. It's not her father. She developed Mueller Hinton Agar, published a paper about it. To this day, it's used as the basis for media to grow Neisseria gonorrhoeae and also for antibiotics. So Mueller was her mentor. After she worked for Mueller, she went to work for the War Department in Arizona as a technologist. She was one of the first two African American women to be a veterinarian. She and Elfrida Webb both graduated from different veterinary schools in 1949 as the first African American female veterinarians. She opens a small animal practice, ultimately went to work for the USDA and survived till 2003. So another sort of remarkable, in a family of remarkable individuals. In 1941, so there's Mueller Hinton Agar. I knew it was there somewhere. In 1941, Mueller brought her to Halifax, Nova Scotia, because they were having outbreaks of meningococcal disease, pertussis. It was terrible in Halifax. So in a group that also included John Dingell, famous microbiologist, as well as Lewis Thomas, author and infectious disease expert, they went to Halifax and as his assistant, Jane Hinton went on that trip. Hinton died in 1959, and in his will, he left most of his estate to Harvard Medical School to fund the Eisenhower Scholarship Fund. He created a scholarship in the name of Dwight D. Eisenhower. Now, he never said why he did that. Eisenhower was delighted, but we don't know. It's interesting. Jane Hinton said that that it was very irksome that Harvard was in a big hurry to get that will probated. She claims they were in a big hurry to get that money. I don't know. I got that third hand. And it's still in existence. The ASM named the Major Research Training Award. This was for microbiologists who excelled in providing training opportunities to minority graduate students. And I'm very happy to say one of the recipients was the late Helen Buckley, whose laboratory I spent 2 years working And I didn't know that until I saw her name on this list a few years ago. The serology lab in 1974 was named after Hinton. This was the old Wasserman laboratory. Of course, they hadn't done a Wasserman test in decades. And it was now the Hinton laboratory. And then in 2008, the entire building, which is now being remodeled, was named the William Hinton State Public Health Laboratory Institute. So Hinton has been recognized by the state and the Department of Public Health on these two occasions. And this is his family at the dedication back at that time. So that is what I know about William Hinton. Before I stop and before we get to questions and I take down my slide, I just want to give a little pitch for the Public Health Museum in Tewksbury, opened in 1994, attempts to present to the public the history of public health. We had a major Hinton exhibit back in 2012, co-sponsored by the Northeast branch of the American Society for Microbiology. The Tewksbury Hospital itself is quite a historic facility, starting as one of the state almshouses in 1854. And the museum has exhibits on smallpox, tuberculosis. It has the building itself is historic from 1895. It has WPA murals, nursing exhibits, mental health exhibits. Finally, after 30 years, we have an HIV/AIDS exhibit because in 1994, AIDS wasn't history. Of course, AIDS still isn't history, but it's more historical than it had been in 94. So now we have an AIDS exhibit, and there are outside tours of the grounds. So I'm going to really stop there, and I think we're open for questions, comments. Anybody who has a Hinton story, especially.
Okay, well, thank you so much for that presentation. I really enjoyed it, and I really appreciate your going through this. A couple of questions come to my mind before I open it up to others. One he was, I guess, early in the game as far as African American students at Harvard Medical School. Do you know, was he the first? When was the first?
No, he wasn't the first. The first was back in the 1860s, the ones that were expelled after the other students complained. So there had been various African American medical students through the late 19th century, early
Okay.
look into the 20th.
Was he admitted before women were admitted to?
Oh yeah, long before.
Yeah, because Mildred Jefferson was the first African American woman, and she was late 40s, as I recall.
The first women were, I believe, in 1949.
Yeah, that was Mildred Jefferson. And if anybody on this line is a member of the Massachusetts Medical Society, she was in the House of Delegates, and she passed away maybe 5 years ago or so. But she was someone that we knew, and yet she held that historic position. And I guess, let me see. The other piece here is, you mentioned about false positives in pregnant women, and we were running, I mean, every pregnant woman in the state, and I was trained in New York and Ohio as well as here, and every pregnant woman got a syphilis test. That was a major thing right up until I guess recently. Any comments on that one at all? Was that a good idea?
Yeah, oh no, it's still definitely recommended, and now in
Yeah.
many cases we recommend two, and it's actually a mandate, but there's a recommendation for two in high risk, and the reason it's a mandate is because if you depend on the judgment of the provider as to someone's risk, you
Yeah.
miss cases.
Yeah.
So it's a universal requirement to this day.
Mhm, mhm. So I don't see questions in the chat. If someone has a question, just unmute yourself and turn on the video and pop in, and we'll be happy to screen it.
Thank you for a fascinating talk. I was
Thanks,
really
Nick.
interested. I'm the archivist and institutional historian at New York Medical College, which is Metropolitan Hospital's academic affiliate. And I had actually never heard of Dr. Easterling or that she had been an intern at Metropolitan. But really, if you know anything more about her that you could say, I would love to hear it. Or if anyone's written about her, if there's any good sources on her.
Yeah, no, pretty much what was on the slide is what I know of her. And I think the reason why she sort of surfaced again was because those progressive students at Tufts back in the 70s who found out about her. And if you go, there are several publications with Hinton and with um, West, the TB serology person, but I really couldn't find much else.